Hey you know how you gave us all that info on naturally dealing with autoimmune stuff?
Right.
Well, think of this as like US going through it all and pulling out the good stuff, the stuff that's going to make a difference, especially for someone like you who just wants to get to the heart of it all. You know what I mean?
Totally. You shared a bunch of articles and studies, and what we're going to do in this deep dive is break them down. We want you to walk away with a clear picture of how these diseases look from a more holistic perspective.
Right on.
We'll dig into potential causes, some stuff that goes beyond what's typically talked about. And of course, we got to get into the natural strategies for getting better, maybe even achieving remission. We're talking real relief and all without the nasty side effects. It's about empowering you, giving you the knowledge to take control.
I love it. So when we say autoimmune disease, most people think of like their immune system going haywire.
Yeah,
It's supposed to protect us from all the bad stuff out there, but then it kind of flips and starts attacking our own bodies. Like it's our own defense system turning against us.
exactly. That's the standard definition. But here's where things get interesting, especially when we look at it holistically. See, conventional medicine, they often label these diseases as incurable, right? And a lot of the time, they're not even sure what causes them in the first place. But the natural medicine approach, it's a different story. They aim to stop the symptoms, or at least drastically reduce them. And the best part, they try to do it without all those side effects you can get with the conventional treatments. It's all about tapping into the body's ability to heal itself.
Makes sense. And it's kind of wild, right, how conventional medicine is pretty upfront about not knowing exactly why the immune system goes rogue sometimes.
Yeah.
They suspect stuff like infections might be a trigger or those big hormone changes, like when someone's pregnant or going through menopause. But the exact reason, it's still a mystery.
It is, and that's a super important point. Because if they don't know exactly why this whole immune system malfunction happens, well, from a holistic perspective, it makes sense that the conventional treatments are just focused on managing those symptoms, putting a Band-Aid on the problem, so to speak.
Yeah.
And that often means suppressing the immune system, which isn't ideal. It can lead to a bunch of side effects. The beauty of the holistic approach is that they look for the root cause. They believe that by addressing those underlying imbalances using natural methods, we can support the body in healing itself. And not just getting better temporarily, but actually achieving lasting relief.
Now, here's what I find really cool about all this. It's not about sitting back and letting someone else fix you. It's about making an active role in your own healing. These sources are pretty clear about that. It requires you to make conscious choices, change your lifestyle, what you eat. It's all about taking charge.
Exactly. You hit the nail on the head. It's not a passive thing. It's about actively participating in your own well-being. And what's even more remarkable is that these natural methods they're talking about, they're not disease-specific. They're not saying, okay, for this disease, do this, and for that one, do that. The underlying principle is to help the immune system rebalance itself so it stops attacking your own body. And that's why these approaches are often presented as being beneficial across a whole range of autoimmune conditions.
So just to give people an idea of the scope we're talking about, the sources list a whole bunch of different autoimmune diseases where these natural approaches might be helpful. We've got type 1 diabetes, where the immune system go after those insulin-producing cells in the pancreas. And there's rheumatoid arthritis, which mainly targets the joints. And psoriasis, where it's the skin cells that bear the brunt of the attack.
Now, those are just a few. We've got multiple sclerosis, where the immune system attacks the myelin sheath, the protective covering of nerve fibers in the central nervous system. That disrupts the communication between the brain and the rest of the body, leading to a lot of different problems. Then there's systemic lupus erythematosus, or SLE, a real chameleon of a disease. It can affect so many different parts of the body: skin, organs, joints, brain, even the heart. It's a really complex.
And the list keeps going, right? Chronic inflammatory bowel diseases, conditions like Crohn's disease and ulcerative colitis. While there's debate about how exactly they fit into the autoimmune category, they definitely involve the immune system causing chaos in the gut. We've also got Hashimoto's thyroiditis, where the immune system attacks the thyroid gland, often resulting in hypothyroidism. Then there's Sjogren's syndrome, which messes with the tear and salivary glands, causing dryness. And of course, we can't forget celiac disease, where the immune system overreacts to gluten. It's really amazing how diverse these conditions are.
It really is. It shows just how many ways the immune system can go wrong and start attacking the body. And even though the symptoms can be super different depending on what's being attacked, a lot of autoimmune diseases share some early warning signs. Things like feeling tired all the time, even after you rest, muscle aches and pains, swelling and redness in different parts of the body, sometimes even a low-grade fever. Brain fog, that difficulty concentrating, that tingling or numbness you get in your hands and feet. Hair loss and skin rashes. It can be a lot to keep track of.
And it can be tricky to get a diagnosis early on because those symptoms are pretty general. The sources also talk about flare-ups and remission. Can you explain what those mean, especially for someone who might be new to all this?
Absolutely. A lot of autoimmune diseases, they don't just stay the same all the time. They go through these ups and downs. The ups are the flare-ups, where the symptoms get really bad. Sometimes you might see the German word Schub used for the same thing. These flare-ups can last for different lengths of time. And then there are the downs, which are the periods of remission. That's when the symptoms calm down a lot, maybe even disappear completely. But even in remission, some people might still have some mild symptoms hanging around. This whole cycle of flare-ups and remissions, it's a pretty classic pattern for a lot of autoimmune conditions.
Interesting. So now let's get into some of the potential underlying causes from that naturopathic point of view. Your sources highlight a few things that aren't always front and center in the conventional explanations. One that really jumped out at me was the role of infections, specifically the Epstein-Barr virus, EBV.
Right. The connection between EBV and a higher risk of developing certain autoimmune diseases is fascinating. There was a report in Ärzteblatt back in 2018 that really highlighted this link. It seems that when EBV infects the body, it can leave behind these little master switches in the immune system's B cells. These are called transcription factors and are usually involved in making new viruses. The crazy thing is, one of these transcription factors, the one EBV leaves behind, it can bind to almost half of the genes that are linked to lupus. So it's like the virus leaves behind a key that can unlock the genes responsible for the disease. That's why the risk of lupus is so much higher after an EBV infection.
And get this, apparently, lupus is never seen in people who haven't had EBV. That's a pretty strong connection right there. And it's not just lupus, the sources say. EBV is also potentially linked to other autoimmune diseases, multiple sclerosis, rheumatoid arthritis, inflammatory bowel diseases, type 1 diabetes, juvenile idiopathic arthritis, and even celiac disease. This common virus might be a bigger player than we thought.
It seems that way. The idea is that in people who are already genetically predisposed to these diseases, EBV could be the trigger that sets everything in motion. It activates those genes, and boom, the disease process starts. This opens up a whole new way of thinking about where autoimmune diseases come from. It goes beyond just blaming our genes or vague environmental factors. It points the finger at specific infections, like EBV.
I like that. So another potential culprit the sources mention is heavy metal toxicity, specifically mercury. That's a topic that comes up a lot in the alternative health world. What did your sources have to say about that?
Well, they pointed to a study from 2015 that found a link between having high levels of mercury in your blood and having high levels of these things called autoantibodies. Now, don't freak out if you hear that word. Having autoantibodies doesn't automatically mean you have an autoimmune disease, but it does mean you're more likely to develop one. The thinking is that heavy metals like mercury can mess with the immune system, causing it to start producing these autoantibodies, which then mistakenly attack the body's own tissues.
And it's not just mercury, right? The sources also mention lead, especially when it comes to multiple sclerosis. Apparently, exposure to lead can activate the production of antibodies that specifically target proteins in nerve tissue. That's a pretty direct and potentially damaging connection.
It is, and this brings us to the whole idea of detoxification and giving your liver some love. The holistic perspective is that we're constantly bombarded with toxins, including heavy metals. And if our bodies can't get rid of them effectively, our immune systems can get thrown out of whack.
So the liver is our main detox organ, right? I remember reading about glutathione in the sources.
Oh, you're totally right. Glutathione is a super powerful antioxidant. And guess who makes it? The liver. It's essential for getting rid of heavy metals. But if the liver is overworked or sluggish, it can't make enough glutathione or the other enzymes it needs to detoxify properly. So the sources really emphasize supporting liver health through diet and other natural strategies. They even suggest looking into gentle liver support and ways to boost glutathione levels. But, a word of caution, they also recommend talking to a holistic practitioner before doing any hardcore detoxing. It's always better to be safe than sorry.
Okay, noted. Now, this next one is a bit of a hot topic. Vaccinations. Your sources touch on this too. What's their take on it?
All right, so they talk about something called AJA. It stands for autoimmune syndrome induced by adjuvants. Adjuvants are like little helpers that are added to some vaccines to make them work better, boost the immune response. The theory behind AJA is that in some people, those specific adjuvants can trigger autoimmune reactions. But here's the thing. The sources are also very clear that for vaccines without those particular adjuvants, there's no solid scientific evidence that they cause autoimmune diseases.
So it's a nuanced perspective. They're acknowledging the possibility that certain vaccine components could be problematic, but they're not saying all vaccines are bad. And they also point out how hard it is to prove a link between a vaccine and an autoimmune disease that might show up years later.
Exactly. It can take a long time for those effects to show up, so it's really difficult to say for sure what caused what. It's a complex issue, and the sources really encourage people to weigh the pros and cons carefully. Talk to their doctor, do their research, and make an informed decision about vaccination. It's all about being aware of the potential risks and the limits of our current understanding.
Now, let's get to something I think a lot of people are really curious about. Nutrition and lifestyle. What can we actually do to support our immune system? Your sources go into quite a bit of detail here, starting with vitamin D.
Oh yeah, vitamin D is a big one. It seems like a lot of people with autoimmune diseases, whether it's multiple sclerosis, lupus, type 1 diabetes, or rheumatoid arthritis, are deficient in vitamin D. There's even some suggestion that if a mother is deficient in vitamin D during pregnancy, her child might be more likely to develop MS later in life. That's pretty wild, right? And there was this study back in 2012. They found that low vitamin D not only increases the risk of rheumatoid arthritis, but it can also make the disease worse.
So it sounds like supplementing with vitamin D could be a good idea, especially if you know you're deficient. The sources mention that it might be helpful for conditions like Hashimoto's, where it could help lower those thyroid antibody levels. And for IBD, it might reduce those flare-ups.
Exactly. While there's still some debate in the scientific community about whether low vitamin D is a cause or a consequence of these diseases, the fact that it's so consistently linked to them and that supplementation often helps makes it a strong contender for treatment. It's a simple thing to do, and it could make a big difference.
So besides vitamin D, what other vitamins and minerals do the sources highlight?
Well, they stress that having enough of all the essential nutrients is super important. There was this review published in 2019 that analyzed 32 different studies, and they found that selenium deficiency was common in people with autoimmune diseases. Now, this deficiency could be because of the disease itself, but it could also be contributing to the problem. Interestingly, when people with collagenoses, which are autoimmune diseases that affect connective tissue, like Sjogren's syndrome, lupus, and rheumatoid arthritis, were given selenoethionine, a specific form of selenium, they saw improvements in their symptoms and less inflammation. The sources suggest taking around 100 to 200 micrograms a day. They also emphasize making sure you're getting enough magnesium. Magnesium is crucial for keeping inflammation in check and maintaining a healthy gut lining, which is key for preventing a leaky gut, a potential trigger for autoimmunity.
We've been talking about leaky gut quite a bit, so now let's move on to omega-3 fatty acids. Those are always touted for their anti-inflammatory benefits. What do the sources say about them?
Omega-3s are definitely a good thing. The sources strongly recommend them, especially for inflammatory conditions like IBD, lupus, MS, and inflammatory skin and joint problems. They do suggest that algae oil supplements might be a better source of omega-3s than fatty fish. That's because of the potential for heavy metal contamination in fish. Algae oil is also perfect for people who are vegan or vegetarian. The sources also recommend keeping your intake of omega-6 fatty acids down. Those are found in oils like sunflower, corn, and soybean oil. Too much omega-6 can block the beneficial effects of omega-3s. It's all about balance, you know.
It makes sense, shifting the balance towards more of those good fats. Okay, let's talk about curcumin. That's the active compound in turmeric, the spice that gives curry its yellow color. It's gotten really popular for its health benefits. What did your sources say about it in autoimmune diseases?
Curcumin is a powerhouse. It's got anti-inflammatory, antioxidant, antidiabetic, and even anti-cancer properties. Some people with autoimmune diseases, like IBD, have reported feeling better after taking high doses of turmeric. There's actually a really thorough review from May 2019 that looked at the effects of curcumin supplements in various autoimmune diseases. They found that in 14 out of 16 studies on arthritis, curcumin significantly improved both the symptoms people reported and the objective markers of inflammation. And in 2 out of 3 studies on ulcerative colitis, they saw similar positive results.
That sounds promising. But the sources also say that some studies, especially those on arthritis and MS, had mixed results. Why do you think that is?
Well, the researchers involved in those studies thought that maybe the dose of curcumin wasn't high enough, or maybe people weren't taking it for long enough to see a real benefit. The bottom line is that the sources recommend giving curcumin a try, especially if you have an autoimmune disease. They suggest at least 1,000 milligrams a day, and you might need to take it for several weeks or even months to see results.
It's not a quick fix. All right, let's go back to the gut. You've been emphasizing how important it is for immune health. How exactly does an imbalance in the gut contribute to autoimmune diseases?
Well, a big chunk of our immune system actually lives in the gut. And all those bacteria that live there, they have a huge impact on how our immune system works. In people with autoimmune diseases, we often see an imbalance in the gut flora. There's less diversity of those good bacteria. This imbalance, it's called dysbiosis, and it can lead to leaky gut syndrome. That's where the lining of the intestines gets more permeable, kind of like a leaky sieve. Stuff that should stay in the gut can leak out into the bloodstream, and that can trigger or worsen autoimmune responses in other parts of the body.
And that's where probiotics come in, right? To help restore that balance in the gut.
Exactly. There was a study in 2018 that found probiotics had anti-inflammatory effects in rheumatoid arthritis, ulcerative colitis, and multiple sclerosis. Now, not all studies have shown the same results, probably because they use different types of probiotics, but some studies have been really encouraging. One from 2016 found that a combination of Lactobacillus acidophilus, Lactobacillus casei, and Bifidobacterium bifidum helped reduce symptoms and inflammation in people with arthritis. Another study found that Lactobacillus casei was good at reducing swelling and inflammation in the joints. There's even some evidence that Lactobacillus fermentum might help with the vascular problems people with lupus experience, and that probiotics can improve digestive symptoms in people with scleroderma. There's also research linking gut bacteria to the development of MS. One study even found that Lactobacillus reuteri improved symptoms and quality of life in people with MS. So while probiotics might not be a cure-all, they can definitely be a valuable part of a holistic approach.
Makes sense. It sounds like supporting a healthy gut microbiome is really important, and diet plays a huge role in that, right? What does an anti-inflammatory diet look like?
Diet is absolutely crucial. It has a direct impact on the types of bacteria that live in your gut, and it can either fuel inflammation or calm it down. So for people with autoimmune diseases, eating an anti-inflammatory, gut-healing diet is key. Now, there's no one-size-fits-all diet, but the sources do recommend avoiding gluten and dairy for a lot of people. So the proteins in those foods can increase intestinal permeability, and that can trigger autoimmunity. The best approach is to experiment and see which foods work for you and which ones don't. Processed foods, sugar, and alcohol are definite no-nos. Focus on real, whole foods, especially fresh, seasonal produce, healthy oils, anti-inflammatory spices, homemade smoothies and juices, lots of salads, and even home-baked bread made with gut-friendly ingredients.
And the sources specifically call out sugar. They even mention a study from Spain in 2020 that found a link between higher sugar intake and more active lupus in patients. That really shows how much our food choices affect inflammation.
No doubt about it. Sugar is inflammatory, especially for people with inflammatory autoimmune diseases like lupus. It just reinforces the importance of eating clean, whole foods, cooking at home, and choosing fresh ingredients whenever possible.
Okay, last but not least, stress. We all know it's bad for us, but how does it specifically relate to autoimmune diseases?
Stress is a huge factor. There's a ton of research on this. A review from Tel Aviv University in 2018 really emphasized that stress can contribute to the development of autoimmune diseases, especially if you're genetically predisposed to them. And it's not just theoretical. Stress is linked to all sorts of autoimmune conditions: rheumatoid arthritis, SLE, IBD, MS, Graves' disease, and many more. The sources even say that stress can make conventional treatments less effective. They mention psoriasis as an example.
So what's the science behind that? How does stress actually mess with the immune system?
It's all about hormones. When we're stressed, our bodies pump out all these stress hormones, like adrenaline, noradrenaline, and cortisol. These hormones can directly affect how our immune cells behave. They trigger the release of signaling molecules, like IL-4, which boost the production of H2 cells, one type of immune cell. At the same time, stress lowers the levels of IL-12 and increases IL-10, which reduces the activity of H1 cells, another type of immune cell. Some creates an imbalance between H1 and H2 cells, which is something we see in a lot of autoimmune diseases. So addressing this imbalance is a big focus in a holistic treatment. The sources really emphasize managing stress. That could mean things like meditation, yoga, spending time in nature, or even therapy, like behavioral therapy, which has actually been shown to help people with autoimmune diseases.
So it sounds like even though conventional medicine often says there's no cure for autoimmune diseases without medication, there's still a lot we can do to manage them naturally and improve our quality of life.
Absolutely. We've covered a lot of ground today: detoxification and supporting liver function, making sure we're getting enough key nutrients like vitamin D and omega-3 fatty acids, considering supplements like curcumin, taking care of our gut health, eating an anti-inflammatory diet, and managing stress. These are all things the sources highlight as potential strategies for feeling better and living well with an autoimmune disease.
And it's encouraging to know that more and more holistic doctors are using these approaches, and they're seeing great results. Of course, it's super important to remember not to stop any medications your doctor has prescribed without talking to them first. And always discuss any new supplements or major diet changes with your healthcare provider. Make sure everything is safe and appropriate for you. The sources are very clear about that.
It's all about making smart choices and working with your healthcare team. The sources even recommend a book by Dr. Susan Blum. It's called Autoimmune Krankungen erfolgreich behandeln, das Vier-Schritte-Programm für ein gesundes Immunsystem. In English, that means treat autoimmune diseases successfully, the four-step program for a healthy immune system. Dr. Blum healed her own autoimmune disease and developed this program, and she's seen really good results with her patients. Sounds like a great resource if you want to learn more.
So, as we wrap up this deep dive, we want to leave you with this. Your body is amazing. It has an incredible ability to heal and find balance. Never forget that. Keep exploring these natural approaches. Be curious, make informed decisions, and remember, your mindset plays a huge role in this journey.
That brings up a good question for you to ponder. Knowing what we've talked about today, all those connections between gut health, nutrition, stress, and environmental factors, what's one small, manageable change you feel ready to make in your own life? Something that resonates with you, something that could be a positive step towards feeling better.
I love that. Think about it, and until next time, stay curious.
Take care.